Hello. Today we'll discuss lacrimal apparatus. Now, to discuss lacrimal apparatus, we'll discuss the lacrimal apparatus in the background of its structure, components, what are its functions served by the lacrimal apparatus in that way. So, the objectives of this topic, the domain we would cover is what is lacrimal apparatus, what are the components, different components and its description, and some applied aspects. So, what is lacrimal apparatus? It is an arrangement of gland and canalicular system which produces tear film over cornea and conjunctiva and conveys tear through nasolacrimal duct into inferior meatus. Now, a few terms like tear film is a very thin layer of tear which is secreted by the lacrimal gland and which is covering the sclera and cornea with each blink of eyelids. It is evenly sprayed and it helps to become the surface moist. The sclera and conjunctival surface becomes moist. And one term like the inferior meatus, it is in the lateral nasal wall. There are some projections from the lateral nasal wall towards the midline septum. These projections are termed as turbinates. There are three turbinates from inferior to superior, that is inferior turbinate, middle turbinate and superior turbinate. The space below the turbinates are termed as meatus. So the space below the inferior turbinate is termed as inferior meatus. So that is important in our discussion because the lacrimal apparatus is consisting of a glandular system which is having a secretory portion and a collecting portion. Secretory portion is mainly by the lacrimal gland proper and some accessory lacrimal glands of say glands of Krauss and gland of Wolfring, and collecting portion which is by the lacrimal canaliculus nasolacrimal duct, nasolacrimal sac, in that way it is forming. So inferior meatus, it is a space between the inferior turbinate. So components. The components of lacrimal apparatus are lacrimal gland with ducts, conjunctiva, lacrimal canaliculi, lacrimal sac and nasolacrimal duct. We will discuss this topic with this following subdivisions. Going to the figure, this picture shows we are facing the left eye and the right side is a lateral aspect, left side is a medial aspect. In the right side, in the superolateral region, that is the temporal region, there is an almond-shaped glandular structure which is indented by the lateral margin of a muscle. This brownish structure is the muscle. The muscle is levator palpebral superioris. The portion, major portion, superiorly present, that lacrimal gland, the major portion which is superiorly present is the gland proper, and the gland below the indentation of the levator palpebral superioris is the palpebral part. Now these two parts is joined laterally and these parts are draining its secretion through separate duct system into the lateral aspect of the upper conjunctiva. Now we can find that the arrows are the passage or the direction of the passage of the tear film which is going towards the medial aspect, and we can find there are small openings in the medial aspect, superior and inferior aspect of the medial canthus. There are small openings. These openings are termed as puncta, superior puncta and inferior puncta, and there are a small elevation which is more prominent in elderly persons. These elevations are termed as papillae. Now from this puncta, superiorly and inferiorly, canaliculi start and they run upward in case of superior canaliculi, and for inferior canaliculi it traverses downward. Then it takes a sharp bend, and the junction between this bend or the junction or the bend proper is termed as ampulla. From there, the superior and inferior canaliculi, they open either separately or after joining into a singular duct into the lacrimal sac, and this lacrimal sac is continued as the nasolacrimal duct. The portion above the opening of the lacrimal canaliculi, the superior lacrimal canaliculi, is often termed as the fundus of the lacrimal sac. Then it is the body, and finally it is continued as the nasolacrimal duct. So lacrimal gland, it consists of two parts, upper large orbital part and lower small palpebral part. Both parts continuous posterolaterally along the concave lateral margin of levator palpebrae superioris muscle. Orbital part or the gland proper, it is almond shaped, present at anterolateral part of the roof of orbit. In lacrimal fossa in zygomatic process of frontal bone, there is a depression in the lateral aspect close to the in the zygomatic process of the frontal bone. This is the lacrimal fossa which accommodates the lacrimal gland. Levator palpebrae superioris muscle present below the gland proper or the orbital part of the lacrimal gland. There are some orbital fat acting as a cushion in between the gland and the bone proper. So this orbital fat is present behind the gland. Now if we look at the figure again, this picture shows the superior part of the lacrimal gland is almond shaped. There is a muscle separating the superior part and the inferior part, or the gland proper, orbital part and the palpebral part is the levator palpebrae superioris muscle. Palpebral part, it is the smaller part, almost 1/3 of the gland proper. It extends into the lateral part of upper eyelid and it reaches the superior fornix of the conjunctiva. There are ducts of the lacrimal gland, they may be 6 to 12 in number. They run beneath the conjunctiva and they open in the lateral part of the superior conjunctival fornix. The arterial supply of the lacrimal gland is mainly the lacrimal branch of ophthalmic artery. Veins usually correspond to the artery. Nerve supply is very important. Sensory nerve supply is the lacrimal branch of ophthalmic nerve. Parasympathetic or secretomotor supply, the fibers originate from the superior salivatory nucleus, then they run along the facial nerve, then along the greater superficial petrosal nerve, traverse through nerve of pterygoid canal, then to pterygopalatine ganglion or sphenopalatine ganglion. Then these nerve fibers relay here. From this ganglion, postganglionic fibers travel along the orbital branch of pterygopalatine ganglion to the lacrimal gland, and along the zygomatic nerve, the zygomatico-temporal nerve communicate with the lacrimal nerve. They eventually supply the lacrimal gland. Sympathetic nerve supply, sympathetic nerve traverses along the major vessels and the blood vessels which are supplying the organ proper. Structure of the gland. Now, the structure of the gland is a compound tubulo-alveolar type. It is secreting predominantly a serous secretion. There are accessory glands present, and these accessory glands, they present near the conjunctival fornices. They are more in upper eyelid than the lower eyelid, and these accessory glands and the lacrimal gland proper, they keeps the conjunctiva moist. And the accessory gland, when the lacrimal gland is removed, its function becomes more conspicuous. These portions of the accessory gland, they keeps the conjunctiva moist if the lacrimal gland is surgically removed or it is removed, not functioning. The structure is somewhat like that. This is tubulo-alveolar gland, Some myoepithelial cells are present over the alveoli. They, when contract, the secretion is poured into the duct system, and ducts are opening into the lateral part of the conjunctival fornices. Conjunctiva. Conjunctiva is an integral part of the lacrimal apparatus. It has got a palpebral part which covers the upper and lower eyelids and falls into sclera, forming a superior and inferior conjunctival fornices. Ocular part, it covers the anterior part of the sclera up to the sclerocorneal junction. It is continuous with corneal epithelium. Arterial supply, it is the medial palpebral branch of ophthalmic artery and lateral palpebral branch of lacrimal artery. Nerve supply, upper half is supplied by the ophthalmic nerve, lower half maxillary nerve. The figure shows the sagittal section of the conjunctiva. We can see the lens, then the conjunctiva, the divisions of the conjunctiva, the fornix superiorly, this cleft-like region is the fornix. The orbital part of the conjunctiva, bulbar part of conjunctiva is visible. So that is a section of lid along with the portions of conjunctiva is nicely visible. Another diagram. There are some enlarged view of the gland and the duct system. Some accessory lacrimal glands are also present here. So that is the description what we have already discussed. It's presented diagram in the diagram. Coming to the lacrimal canaliculi. These are present one in each eyelid, superiorly and inferiorly. Length is almost 10 mm. Course, the superior canaliculus. It commences at the lacrimal punctum. At the medial end of upper eyelid, it ascends medially, then bends sharply and pass downward medially to end in lacrimal sac. Inferior canaliculus, likewise, it commences at the lacrimal punctum at the medial end of lower eyelid. It passes downward medially and bends sharply, then ascends medially to end in the lacrimal sac. This canaliculus, this inferior canaliculus, is larger than the superior canaliculus. Ampulla. The canaliculus have ampulla at the angles. The ascending and descending portion of the initial segment of the lacrimal canaliculi, when bends sharply, this sharp bend, it forms a somewhat dilatation that is called as ampulla. Structure, the mucous membrane is lined by the stratified squamous epithelium. Some striated muscle fibers are present which is continuous with the lacrimal part of the orbicularis oculi, and near the lacrimal puncta the fibers act as sphincters. Lacrimal sac. It is the upper dilated blind end of the nasolacrimal duct, lodged in the fossa formed by lacrimal bone and frontal process of maxilla. They covered laterally by lacrimal fascia. The dimension of the lacrimal sac is somewhat like it has a length of 12 mm and breadth 6 mm. Upper end is closed, flattened. It is often termed as fundus. The portion of fundus is usually above the opening of the canaliculus. The superior canaliculus opens below the fundus. The level above the superior canaliculus opening is termed as the fundus. The rest is body, and finally inferiorly it is continuous as the nasolacrimal duct. Mucous membrane lining is by columnar epithelium. Medial palpebral branch of ophthalmic artery is the vascular supply of this lacrimal sac, and anastomotic twig of facial artery and inferior palpebral branch of medial palpebral artery supplies this portion of the gland and lacrimal sac. So the figure again, this shows the lacrimal sac and nasolacrimal duct. Finally, we will go to discuss the nasolacrimal duct. It is the final structure or the duct system which carries tears from the lacrimal sac to the inferior meatus of the nose. Situation, it is situated in a bony canal formed by maxilla, descending process of lacrimal bone and lacrimal process of inferior nasal concha. Length and breadth is somewhat 18 mm length, 3 millimeter breadth this nasolacrimal duct is having. Lining epithelium, columnar epithelium, and some places it is ciliated. Blood supply is the medial palpebral branch of ophthalmic artery, and again an anastomotic twig of facial artery, and inferior palpebral branch of medial palpebral artery supplies this portion of the nasolacrimal duct or the nasolacrimal sac. Lacrimal gland and lacrimal sac, they are developed from ectoderm. When a solid ectodermal cellular cord canalizes, they forms the sac, and gland usually becomes a solid clump of cells, and when it canalizes, it forms a duct system of the gland. So this is overall description of the parts of lacrimal apparatus, consisting of the secretory portion and the collecting portion, having the lacrimal gland, accessory lacrimal glands, conjunctiva, lacrimal sac, lacrimal canaliculi, and nasolacrimal duct. Applied aspects, there may be defective developments giving rise to congenital stenosis of the duct system. There can be acquired stenosis of the duct system. There can be inflammation of the gland leading to acute dacroadenitis. It can be inflammation of the lacrimal sac and nasolacrimal duct system giving rise to dacrocystitis. So these are the applied aspects. So to sum up, the lacrimal apparatus is consisting of not only the lacrimal gland, which is the secretory portion, but also it consists of the collecting portion of the gland, that is the lacrimal canaliculi, conjunctiva, then the lacrimal sac, nasolacrimal duct. There can be various diseases affecting this passage. So for normal functioning of this duct system and the gland system is to keep the conjunctiva and cornea moist. There is smooth movement of the eyelids. There are different enzymes and secretory immunoglobulins present in the tear film that protects the surface. So that is protective in nature, and the inflammation of these structures can give rise to different clinical situations. So that is all. Thank you. Thank you very much.